Scleroderma or systemic sclerosis is a multi-system disease characterized by autoimmunologic processes, vascular endothelial cell injury, inflammation, and an extensive activation of fibroblasts. The skin, esophagus, lung, heart, and kidneys are the most frequently affected organs. Systemic sclerosis can be categorized into two subsets, limited and diffuse. Clinical features common to both are skin sclerosis and Raynaud's phenomenon. Limited systemic sclerosis is characterized by a long pre-existing history of Raynaud's and skin changes of the extremities distal to the knee and elbow joints, including facial skin. Diffuse systemic sclerosis, on the other hand, is characterized by rapid skin involvement of the trunk, face, upper arms, and thighs. It is associated with a higher propensity to develop pulmonary fibrosis, cardiac involvement, and scleroderma renal crisis. Distinctive for systemic sclerosis is the initial onset of Raynaud's phenomenon, defined by recurrent attacks of vasospasm of small arterioles or arteries of the fingers and toes, usually caused by cold and other stimuli like emotional stress. It appears suddenly, is clearly restricted, and is characterized by triphasic color changes, that is, pallor, cyanosis, and rubor of single or several digits. Skin involvement is usually seen first in the fingers and hands. There is non-pitting edema of the fingers, hands, and extremities, followed by an increasing in duration and skin thickening. Depending on the localization of skin thickening, restricted mobility of joints and/or restricted breath excursion may be present. Typical facial features include loss of normal facial lines, mask-like fascies, beak-shaped nose, thinning of the lips, microstomia, and radial perioral furrowing. This causes difficulties in eating and oral hygiene. Other skin manifestations include hypopigmented and hyperpigmented salt and pepper skin and loss of hair follicles and sweat glands, causing hypohidrosis or anhidrosis. Patients can also develop calcinosis cutis, which is the abnormal deposition of calcium in cutaneous and/or subcutaneous tissue, as well as digital ulceration, which is associated with vasculopathy. Differentials include morphia, scleroderma, scleromyxedema, and eosinophilic fasciitis. Systemic sclerosis is still incurable, and management includes organ-based symptomatic therapy. For example, patients presenting with gastrointestinal symptoms like reflux are treated with proton pump inhibitors. Patients with Raynaud's phenomenon are frequently treated with calcium channel blockers. General immunosuppression can be of benefit by improving skin involvement and interstitial lung disease. This includes cyclophosphamide, mycophenolate mofetil, steroids, and biologics such as rituximab. Other supportive therapies such as wound care for digital ulcerations and physical therapy for skin hardening and contractures are also very important.